going to look at are our hip flexors. So sometimes these can get tight due to like people sitting down at an office all day with their hip always being in that flex position, or sometimes if you're standing for long periods, so you get in that lazy position of like standing like this and your hip flexors can get tight, both leading to lower back pain. So what that does potentially is a tight hip flexor at the front of your actual pelvis can tilt the pelvis forward, leading to like a jarring sort of sensation at the back near your SIJ joint. So what we're going to demonstrate today is a good stretch for your hip flexor using our superstretcher. So these are available at the clinic for $20, so you can do a lot with these. Tommy's going to demonstrate a good technique.
Okay, so what you're going to do is get the leg you're stretching, or the hip you're going to stretch, into the superstretcher. Get into a lunge position, so 90 and 90. Alright, you can hold on to this leg as a bit of support if needed, or grab a chair if you feel like you're going to fall. So what you should be feeling is almost like a pull through the front of the hip here, and if you can get a little bit of traction on the superstretcher at the same time, and with the side you're stretching, you're going to bring your arm up and sitting across. So that vastly increases the stretch of the, say, psoas muscle, which attaches from your lumbars all the way down to the front of the hip. And what you're going to do to help bring the position of the hip forward is squeeze your glutes, or squeeze your butt, for about 5 seconds, and then you're going to release. So then the tension on the superstretcher will pull the hip a little bit more forward. To make the stretch even more, what you can do is grab the ankle as well. So that will also add not just the hip, but also add the quads as well, as some of the quad muscles attach above the hip. So the same thing, you want to squeeze the glutes and then relax and allow the superstretcher to pull the hip a little bit more forward. All right.